Hi, good morning Augusto. My name is Vanessa Carmen. I'm your invigilator for the OET speaking session on the 23rd of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Augusto Carlos.
And what is your candidate number, please?
My candidate number is 236282127.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How would you deal with an uncooperative colleague?
In an organization, we will have to deal with all kinds of people. Some of them might be difficult to deal with. That doesn't mean the situation makes me lose myself. Being an employee, it is also my responsibility to maintain harmony in the workspace, and I will do my best to enforce it. In case there is an uncooperative colleague working with me, I would try my best to help them and encourage them to perform better.
What are the precautionary measures you take when dealing with a chronic patient?
Chronic patients can be pretty difficult to deal with, as they are resigned to their fate and have very little faith in a full recovery. Being a nurse, my duty is not only limited to giving them their medications, but also extends to cleaning them up and also reporting their progress regularly to the doctors. A bit of optimism and cheerfulness can make all the difference to their life. I would establish open communication channels and talk to them about their physical, mental, and emotional problems.
How well can you cope with the advances in medicine?
The medical field has come a long way since the times when nurses have to maintain manual journals and jot down notes consistently. The interviewer wants to check your technical know-how and competency. I am pretty familiar with the latest devices, systems, and programs associated with the medical sector. I can work on advanced databases, applications, and analytical software for faster, accurate, and efficient sorting of information.
What would you do if your replacement didn't arrive?
Nursing duty works in shifts. Each employee has a time period allocated to them. There may be times when someone would need an emergency leave or is late to their shifts. If the problem is genuine, then I have no problem cooperating. However, I won't hesitate in reporting to the authorities if my colleagues are slacking or irregular with their work.
Are you a team player?
An ideal healthcare organization won't be complete with candidates who are comfortable working in a team. A cooperative, compassionate and easygoing persons are the assets of any medical institute. Yes, I am a team player. And I understand the importance of teamwork, and I am willing to be as cooperative with my colleagues as the situation demands. I am capable of taking charge of a situation, make quick smart decisions, and also follow orders to the team.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hello. My name is Augusto Carlos. I am a registered nurse in this clinic. May I know what brings you here today?
Hello. My name is Vanessa. I am the daughter of Wesley Albert, who is a regular patient in this clinic.
Oh, yes. I am Wesley's attending nurse in the clinic. How may I help you today?
Nice to meet you, nurse.
Thank you. I am glad to meet you too.
Actually, I am here with an inquiry regarding a blood test.
All right. I hope I can help you.
Okay, nurse. During the last visit, my mother has been advised to go for a blood test. But I wonder why she needs that, as she is quite healthy and nothing seems to be wrong with her.
Your question is really sensible, and I am glad to help you with the answer. Usually as the age increases, there are chances to get more disease. A routine blood check for a person in your mother's age would be quite beneficial to check the general health status, liver, and kidney function, as well as the impact of current medication on her. Am I clear so far?
Oh, yes.
So, just consider blood tests as a part of routine check, like blood pressure, or a cognitive function test. Is that okay?
Yes, now I am clear about the reason to have a blood test.
All right. Do you have any other concerns?
Yes, nurse. Even though a blood test is necessary, I really don't like the idea of pricking my mother, as it causes bruising after every blood test.
Being a daughter, your worries are appreciable. Bruises are something very common in older people. It is because their skin is very sensitive, and the veins are less pronounced.
Okay.
But there is nothing to panic about. It is usually harmless and fades quickly.
Oh, I see.
And if your mother experiences any sort of pain on the site of a blood test, she can administer paracetamol for the pain relief.
All right, nurse, but my major concern is about her fasting.
Fasting? Can you please make it clear for me?
Sure. During the last test, my mother fasted a whole day prior to it. Does she need to do the same for this time? If so, I don't appreciate the idea, considering her age and physical health.
Your thoughts are considerable. I can give you a brief information about fasting. Shall I proceed?
Sure.
First of all, it is not necessary to fast a whole day. I would like to suggest that fasting for 8 hours, with water consumption and regular medication, is fair enough for a blood test.
Okay. I understand that.
And I strongly advise your mother to carry out the blood test in the early morning, so that a lengthy fasting can be avoided.
Yes, that's the best option my mother can follow.
Thank you for accepting my suggestion.
By the way, nurse, if her report finds any abnormality, then what would be the next step?
That's a very good question, Vanessa. If there are any findings in the report, it is best to fix an appointment with the GP to discuss the results and get an appropriate treatment.
All right, nurse, I will do that.
Meanwhile, I would like to suggest you to accompany your mother during the test and her follow-up appointments, which helps her to gain confidence and trust during the sessions.
Sure, nurse. I can come along with her.
Good. I hope I have clarified all your doubts.
Yes, nurse, thank you.
It's my pleasure. Looking forward to meeting you on the test day.
That is the end of your OHT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.